there is something called as a guided tissue regeneration. This is actually nothing but the name given to the regenerative surgical procedure. Why it is important to call it as a GTR or a guided tissue regeneration is because we as a dentist, we are guiding the correct tissue to regenerate in the area where there is a bone loss. So what is the principle of guided tissue regeneration is nothing but we will guide the correct tissue to regenerate in the area where there is a bony defect. So what I mean by this is whenever there is a bone loss, you open up the gingival flap, you clean up the area thoroughly, you pack it with bone graft material. After packing that area with bone graft material, if you suture back the flap in position, what happens on top of the bone graft material or the defect, the gingival flap has fallen back and you have sutured it. Now there is a tendency for bone cells to repopulate that area and form new bone. There is another problem, the tendency for gingival epithelial cells of the flap to regenerate. There is also a tendency for the connective tissue cells of gingiva to repopulate the area. So when the repair or healing process is happening, the bone cells are trying to regenerate, the epithelial cells of gingiva is trying to repopulate, even the connective tissue cells of gingival epithelium or the gingival flap is trying to repopulate the bony defect area. So the problem is the gingival epithelial cells have a rapid proliferation or a rapid turnover rate. In a time of 7 days, it can completely cause an attachment to the bony defect area. So what happens is if the bone graft is placed inside the bony defect and we just suture back the flap in position, what happens there is a long junctional epithelial attachment that will form, and that is how the healing will happen after the flap surgery. So what happens with a long junctional epithelial attachment is that it is a very weak attachment and it is like a suction effect. The epithelium of the gingival flap is just passively attached to the tooth root surface. Even if there is little bit plaque accumulation, it will just open up like how the suction effect goes off and a recurrence of pocket happens and bone will start rapidly resorbing. So that is why we cannot allow the gingival epithelium and connective tissue cells of the flap to regenerate in the bony defect area. So how can we protect the bony defect area? After we pack in the bone graft, what we do is we adapt a membrane over the bone graft. This membrane can be a synthetic collagen membrane that we get to buy from various manufacturing companies, or it can be a connective tissue graft that we can harvest from the patient's palate. So mostly what we do is we use the synthetic collagen membrane. So this is just a square piece of square piece of membrane. What we do is we take and cut it to the size of the bony defect that we have filled with bone graft. Just adapt it and place it over the bone graft material. Then you place the gingival flap on top of it and suture. So now what we are doing is we are separating the bone graft from the flap. So now the epithelium and connective tissue of the flap cannot come inside and repopulate the wound area. And what happens is bone regeneration will happen and the defect will get covered. So as you can see here, it is not only the 2-wall and 3-wall defect wherein you can fill the bone graft. You can also fill if you have a grade 2 or grade 3 furcation defect. A furcation involvement of grade 2 or grade 3 is like you can see here, the furcation has a bony defect which can be filled properly with bone graft material. On top of that, we need to place or adapt a membrane and suture. So when you do like this and suture back in position, you are guiding the correct tissue to regenerate and you are not allowing the gingival epithelium or connective tissue to regenerate. So this is called as a guided tissue regeneration.